Real quick, I just want to highlight detoxification services. It was described as withdrawal when someone stops using a substance or when someone reduces their use of a substance after using it regularly to the point that they are physically dependent. The concept of withdrawal describes those physical and psychological symptoms that can emerge once they stop using that substance. So, for example, if someone were physically dependent on opioids, for example, and then they stopped taking those opioids, those severe flu-like symptoms that have been described would be the concept of withdrawal that I'm explaining right now. And so with detoxification services, they focus on reducing the impact and severity of withdrawal by providing effective treatments. And so yes, essentially detoxification services focuses on managing and treating withdrawal symptoms. And then medications may be provided to reduce the experiences of withdrawal symptoms. Now, the severity of withdrawal and the specific substance that a person is experiencing the withdrawal symptoms to, such as whether it's alcohol or opioids or even tobacco, for example. So the specific substance and the severity of their withdrawal symptoms can often cause them to be referred to different types of detoxification services. So with someone having mild or occasionally moderate withdrawal symptoms, they could be referred to outpatient detoxification treatment. So there is outpatient detoxification treatment. And there's also inpatient detoxification treatment, which could be more of something that's referred to someone who has who is experiencing severe withdrawal symptoms, or who may be experiencing life-threatening withdrawal symptoms, thinking to alcohol withdrawal and benzodiazepine withdrawal, for example. And speaking of benzodiazepine withdrawal, there's actually a book called Blood Orange Night by this author, Melissa Bond. I may cover that at some point, but she talks about her experiences with benzodiazepine withdrawal. But jumping back into detoxification services, so ultimately, these detoxification services aim to treat the withdrawal symptoms, and it's typically seen as a first step before someone actually enters treatment. So helping them detoxify from the substance and reducing their experiences of withdrawal so that they can enter recovery in a treatment setting for long-term follow-up care. And so detoxification services are extremely important because the experience of withdrawal is typically something that people cite as a reason why they don't try to enter treatment, if they have a substance use disorder or addiction. So it's often cited as a reason why folks don't enter treatment or don't want to stop using a substance. But something like detoxification services can definitely help to reduce the experiences of those symptoms and hopefully assist that person towards their goal of reducing their substance use either to zero completely, which is the abstinence approach. And then there's also the harm reduction approach, where someone may want to reduce their substance use overall, but not want to stop completely, which I may kind of describe one day. Some of the pros and cons, or not necessarily pros and cons, but some of the different perspectives surrounding harm reduction versus abstinence-based treatment models. And so again, detoxification services are extremely important because they assist in treating and reducing the impacts of withdrawal. So I hope that someone out there found this video useful, and I thank you so much for watching. Thank you.